In today's video, we're going to go over the two quiz questions from the prior video, a case of acute pyelonephritis, and two new quiz questions. So one of the quiz questions from the prior video was this image, and this is an example of metastatic calcification of the myocardium. You could be forgiven if you confuse this with maybe a myocardial infarct, less so a calcified ventricular pseudoaneurysm of the myocardium. This is an etiology that can be seen when a patient has some kind of hypotensive syndrome and acute kidney injury at the same time. Typically, it's a combination of sepsis with hypotension and acute kidney injury. This tends to lead to fairly rapid calcification of the myocardium, happening over the course of just a few days to maybe a week or two, and these tend to not cause any significant cardiac dysfunction. The second case was this image here, and the question was, what is the cause of this effusion? So in this image, this is actually a chylous effusion, and it's secondary to this mass, which is compressing or injuring the thoracic duct, and this turned out to be a lymphoma. So we're going to move on to our cases, and this is a case of a 53-year-old female with abdominal pain, fever, and leukocytosis. So we'll just take a quick scan through, and we'll go through our usual search pattern. So the partially visualized liver is diffusely hypoattenuated. It's darker than the spleen, which is a good internal control. The partially visualized spleen is normal. The pancreas is normal. The gallbladder is normal. The adrenal glands are not completely visualized but demonstrate no abnormality. The right kidney is normal. The left kidney, we start to get some hypoattenuation and loss of corticomedullary differentiation at the superior pole. We'll take a look at the vasculature, and the portal venous system that we can see is normal. We'll take a look at the aorta and its major branches, and other than a little bit of calcified atherosclerotic plaque, it is pretty normal. No lymphadenopathy here. And we'll just take a look and see, take a look at the bowels that are present on these slices. And we'll just look at the stomach over here, follow the duodenum, then take a look on the left, generally evaluating the bowel, and the right, evaluating the bowel, the small bowel, and then we'll try to follow whatever portions of large bowel we can. And over here, and crossing with the transverse colon. And it is pretty normal appearing. The subcutaneous tissues and the musculature of the abdomen is unremarkable. There is no spinal cord abnormality. I would normally put this in bone window just to make sure there's no osseous abnormality, but we're not able to do that with this screen right now. So this is a case of acute left pyelonephritis involving the superior left renal pole. You want to watch out for any kind of perinephric fluid collection or perinephric abscess with these cases. Speaking of an abscess, this is an example of a right renal abscess, and this is something that can develop if you do not treat the pyelonephritis accordingly. So here we have an enlarged right kidney with a fluid collection and some surrounding inflammatory changes. Just to take a look on ultrasound to see what pyelonephritis looks like, here is the normal appearing right kidney and the abnormal appearing left kidney. And this is abnormal because there is some hypoechoic thickening of the cortex and loss of the corticomedullary differentiation here. if we look at the vasculature of the left kidney, we don't see much Dopplerable signal here. And again, the left kidney, we see some vasculature or some Dopplerable flow within the hilum, but not much within the cortex, and especially not within the thickened hypocoel cortex. If we take a look at the normal contralateral right kidney, this is what normal vascularity looks like. So if you just had the ultrasound, you would be stuck with either acute pyelonephritis or a renal infarct, but depending on patient history and any additional information, then you can lean towards one or the other. So that is the case for today. We'll go over 2 new quiz questions, and they're both regarding central CNS infections. So this has a specific, this is a sign. This is not the best example. This enhancing nodule should be a little more eccentric for it to be more classic, but let me know what the sign is and what the infection is. That's the first image. And the second image is another central CNS infection. And what is the name of the sign? And what does the sign imply as the etiology for infection? This is one image, and the second image. These are both the same infection, different patients. That's it for this video. If you liked, then give it a thumbs up, and if you want to be notified when I put out more videos, then subscribe to the channel. Thanks.